Hey there. Now our topic is mood stabilizer. So what is mood stabilizer? This is a kind of medicine used to treat mood disorder such like bipolar disorder, can be schizophrenia and depression also. So what is bipolar disorder? It is also called manic depression. It is characterized by severe mood swing from manic high to depressive lows. This can cycles uh, last for months at a time. So, what are the symptoms in the regarding this bipolar disorder? It can be mania, depression, impulsiveness, behaviors, feelings of hopelessness, hallucination, delusion, lethargy, inability to focus, impaired judgment, and sometimes feelings for suicide. So, what are the types of mood stabilizers? You can see lithium, anticonvulsant medicines like valproate, carbamazepine, any others, antipsychotics medication like aripiprazole, lurasidone, olanzapine, etc. So what are the goals of mood stabilizer? It is used to reduce residual symptoms, to prevent manic or depressive relapse. It reduces the frequency of cycling into the next manic depressive episode. It improves the functioning of different type of causes to mood swing. It reduces suicidal risk also. Now, lithium a categorized drug which is used um, which interact with various neurotransmitters like noradrenergic, dopaminergic system. Lithium appears to reduce presynaptic dopaminergic activity and acts postsynaptically to prevent the development of receptor by upregulation and supersensitivity. Now, in case of cholinergic process, lithium enhances the receptor-mediated responses at neurochemical, electrophysiological, and behavioral levels. It also increases acetylcholine synthesis and uptake. In case of serotonergic process, it increases central serotonergic transmission. And GABA and glutamate um, types, they increase the GABAergic inhibition and reduce excitatory glutaminergic neurotransmission process. It also change in receptor sensitivity, like associate with chronic administration. Now, what are the side effects of these drugs? It can be produce nausea, vomiting, diarrhea, trembling, increased thirst. It also may increase need to urinate. Weight gain, drowsiness, a metallic taste sensation in mouth always. Now some contradiction of lithium, renal and cardiovascular diseases. In case of sodium depletion, dehydration, patient on diuretics may can use this drug or but contradiction are also there. Uh, During pregnancy and lactation, the mother never use this kind of drugs. Some two different categories drugs are also here enlisted. You can see like anticonvulsant valproate. It is a simple monocarboxylic acid. Now the first choice of treatment of mania, actually less effective than lithium in treating mania, but does also help decrease depression more effectively than lithium. It is especially good for the treatment of acute mania or acute maniac disorder. Now, this drug functioned by GABA agonist process. It enhances synthesis or release of GABA. It awake inhibitor or inhibition of GABA transferase and Succinic semialdehyde dehydrogenase. It is a glutamate antagonist. Now, some adverse effect you can see drowsiness, dizziness like effects are there. Some contradiction, it increases the risk of birth defect. Can cause some problems with the liver. It can interact with other drugs like aspirin and cause severe problems. Antipsychotic drugs like phenothiazine, flufenazine, trifluoperazine are also enlisted in this categorized drug use. The typical antipsychotic block the dopaminergic system and in the site of postsynaptic receptor. Some side effects you can see sedation, weight gain are there. It contradict in case of hypersensitivity, blood diuresis, Parkinson disease, and in case of severe hypotension.